number of issues that have caused us all concern for our own personal safety. If you find yourself in a situation where infection or disease transmission is of risk, then wearing a mask is certainly advisable. Always gloving up before we approach someone. And traditionally, we would have done what's called a primary assessment using the ABC steps: airway, breathing, and circulation. In this unique situation, because of our concern for our personal safety and the safety of the patient, we're going to do what's called a visual primary assessment. And that includes looking at the face to see if there's a change in color. People who are not breathing usually turn pale, bluish, or gray. We're going to look to see if there's any movement in the chest. We're also listening to see if there's any sounds of breathing. We do that for 10 seconds. If there's no indication this person is breathing, they need CPR. Now, we've already sent someone to call 911 and bring the defibrillator. The position is exactly the same. We're going to landmark between the person's armpits in the center of their chest, putting our heel on the sternum, your other hand on top. We're going to interlace the fingers, lock your elbows, chest over chest, and we're going to push straight down 2 inches at a rate of 100 to 120 per minute. So I'd like you to get down with your doll, your pillow, or your partner, landmark in position for continuous CPR compressions. And we're going to begin. Count with me out loud, please. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9 and 10 and 11 and 12 and 14 and 15 and 16 and 17 and 18 and 19 and 20, 1 and 2 and 3, 4 and 5 and 6 and 7 and 9, 30, 1 and 2 and 3 and 4, 5 and 6 and 7. We continue CPR compressions only until this person responds, the AED arrives, you're too exhausted and someone can relieve you, or professional help arrives. Again, the visual primary assessment is used anytime there's a suspicion of disease or infection transmission. Wearing a mask, gloves, a gown, even goggles is perfectly acceptable. So please, review this tape, review your ebook, and we'll see you in class.